artificial intelligence.
Thank you very much, Professor Medina, for the kind invitation. It's a pleasure and a privilege to be here with you all. These are my disclosures. So when evaluating a structural OCT, a volume scan, we perform a sort of dissection of the retina, and we evaluate different parameters like a diffuse retinal thickening or detached posterior hyaloid, the pre-retinal blurring, subfoveal neurosensory detachment, the presence of microaneurysms, the presence of hard exudates, or the hyperreflective foci. And then we start to evaluate the focal changes of the inner retina reflectivity, like drill, or the cystoid spaces that may differ for extension, localization, and also level of reflectivity. On this base, several clinicians tried to classify different diabetic macular edema on the base of a predominantly vasogenic diabetic macular edema or neuroinflammatory macular edema by associating to the latter the subretinal neurosensory detachment, the presence of a higher number of hyperreflective foci or drill. But this work and this approach in our overbusy clinical setting might be definitely difficult. And so the question is, may AI be helpful in characterizing different DME phenotypes? Some years ago, a group of researchers from Vienna postulated and validated an AI approach able to detect and quantify macular edema in neovascular AMD, diabetic macular edema as well, or in retinal vein occlusion with very good and reliable results in terms of intraretinal fluid detection and quantification, while some issues related to DME were appreciated in the detection and quantification of subretinal fluid. So we can conclude there is a need for a specific algorithm for different retinal disorders. Since then, several fluid detectors achieved very good results and in some cases provided relevant clinical findings, like in this case where the subretinal fluid was associated with a lower baseline visual acuity, but with a good response to the treatment. When trying to define the proof of concept in outlining a phenotype of diabetic macular edema, AI was applied and was helpful in finding a potential correspondence in between the level of cytokines and the aqueous humor correlated to specific biomarkers of structural OCT. And in this case, the levels of VEGF demonstrated a strong correlation with specific intraretinal fluid texture patterns. Also, the photoreceptors were evaluated by AI, and convolutional neural network were useful to segment the photoreceptors and also to quantify the photoreceptors, and produces reliable results from one side, and from the other side, data that might be useful to evaluate longitudinally the patient and the prognosis of the patients, the visual outcome of the patient itself, along with the treatment. Some biomarkers, some specific findings are much more difficult to be defined, and this is the case of hyperreflective foci, for example, which, although detectable on structural CT by AI, suffer from major issues related to the HRF definition, as in this case, you can see that both clusters of or hard exudates of granular remnants of the outer segment were defined as hyperreflective foci, which are definitely different to what we mean by hyperreflective foci. And some other issues are evident when trying to define the origin of macular edema, on the base of different structural OCT parameters. And also in this case, the problem is the lack of a consensus in terms of definition for different retinal disorders by associating the structural CT finding to the diagnosis of the disease itself. And also, as for the case of hyperreflective foci, you can clearly see here as well that some cluster of hard exudates are defined as hyperreflective foci within the study. So with the group of Professor Midena, we recently validated a semi-supervised approach, so an AI algorithm which is specifically designed for diabetic macular edema and is based on adversarial generative networks that are able to take from a small data set of manually defined finding by the clinician and to propagate them in obtaining a fully labeled data set along with a big database. And with this approach, we were able to define or outline different biomarkers by the AI algorithm, which are the intra and subretinal fluid, the volume and their topographic localization, the number of hyperreflective foci, and the integrity of the external limiting membrane and the EZ. And we can assess them separately by highlighting the hyperreflective foci, the EL, EZ integrity, the intra-subretinal fluid, and the whole retinal and choroidal layers. We can also evaluate them longitudinally along with the treatment, and also to evaluate them both qualitatively and quantitatively, also including the fluid localization that changes along with the treatment. In the validating process, in the last part of the validation, we included more than 300 eyes in 4 different centers, and the inter-rater agreement in between them was extremely high. And we're looking, for example, to the hyperreflective foci. When comparing the differences in between the AI assessment and the clinical assessment, we can clearly see that these differences are within 2 standard deviations, so the data are extremely reliable. With an overall accuracy for the different parameters, they reached the level of 95%. So in conclusion, the AI-based algorithms are diagnostic tools able to identify in a reliable way different biomarkers that characterize DME, and we fully encourage the integration of these approaches into our clinical practice. And thank you very much for the kind attention.
Thank you very much. Any questions?
Yes. Great talk. Thank you very much. I just wonder if you could use this in the future for the choose of treatment. Some diabetic macular edema response to the corticoid, some of them for anti-VEGF. Regarding of those biomarkers, will it be possible to choose any treatment?
Thank you very much. This is for the question. This is a great point. We hope that by outlining a specific phenotype of macular edema, we were more than able to target some specific subtype of macular edema in order to have a tailored treatment in any single case. So this is the final aim of our research. Thank you.
I think the major issue here is to answer this question, is if this type of macular edema is inflammatory, that might need anti-inflammatory treatment, or it is non-inflammatory that might benefit from anti-VEGF agents.
Yeah, this by associating some data that we obtain with the big data that provided by the AI. Obviously, we have some data-driven findings that we potentially correlate with the different subtypes of macular edema, and then also the treatment. Yeah. And for those inflammatory cases would be much more tailored.
Can you tell that those patients with more hyperreflective dots, which can represent microglial activation, will benefit better from steroids?
Definitely, you have seen that in the literature. Actually, there are some incongruences in terms of definition, but by outlining the exact finding as Elisabetta and Julia previously showed, I do think that we will move toward the right direction.
Okay, thank you.
Thank you.
Excuse me. Yes. Just a small note here. Can you hear me here?
Yeah.
We've been doing a lot of AI work, and with computer application department, we started a study. So we was focusing on the cysts, and we came up with 4 parameters. Though these are not really fixed as of now, but the size of the cyst, number two, where the cyst exists, whether it's in the inner layers or the outer layers. What we found is that the outer layer cysts are more dangerous for the vision than the inner layers. One thing which very important Dr. Busrar was telling about is the reflectivity of the fluid. So what we were checking and the data is still not finalized, that if you have this cyst with clear fluid, it responds more to anti-VEGF. But you have a cyst which has turbid fluid. You'll see in your OCT sometimes the fluid with having a turbidity inside, the reflectivity is high. So these respond to steroids more. Apart from that, we don't have a fixed data still, but if you want to differentiate between the cyst, whether these cysts are inflammatory or because of the damage to the Muller cells, so some structural damage, the structural damage, ICT, these cysts are more having squarish or straighter lines. But if you have a cyst which is more of, because of diabetic process or Muller, these are more roundish cysts. So we have not finalized our data as yet, but we were focusing on the type of cyst, the location of cyst, the size of the cyst, as well as the reflectivity of the cyst. So this just a small note I wanted to add on.
Okay, thank you very much.
I completely agree. Also, the specific texture of the cystoid spaces and also the level of reflectivity that is derived by this texture will be definitely a good point to be assessed. Thank you.
Okay, thank you very much. We'll move to the next speaker. This speaker is